Hey everyone, it's Miles here, and we are 2 days away from being 2 months post-op surgery. I have not made a video in a little while. The last time I did, I was having some complications where I had my right drain in for 30 days. I was going to have it in longer because I was getting medicine put in through the drain. That was supposed to stop the fluid and close the seroma, which is a fluid pocket after surgery. And so I was supposed to have it in for about 36 days, but it tore out on its own after 30 days. And I also got an infection from the drain, and so it was just like a real hard recovery, like harder than I thought it was going to be. I'm still not perfect. After my drain ripped out, the side of my chest kept on building fluid up for several weeks. And finally now it's been about a week and a half with no fluid. So about 2 months post-op surgery, and I'm finally starting to feel normal. My chest is very tight. I'll show everyone. It's really tight along here, like it feels like a rubber band that doesn't stretch. But my nipples are looking alright. They look pretty good. They don't have an actual nipple, it's just more like an areola. Which is one thing that I was kind of sad about. But, I'm still pretty happy with it. Like, it looks better than I thought it was gonna look, and you could see like there's still the fucking hole from my drain that came out after 30 days. But I still feel like my nipples are a little lower than they should be. Like if they were like right here, maybe I feel like that would be better. But at the same time, like just looking at it, it doesn't look that bad, and you can't really tell that it's too low, unless you're critiquing it like I do, of course. But I'm super happy. Like, I love the way I look in my tank top. I feel great. Like, I'm starting to get used to like not having a binder on all the time, which for a while that was some anxiety that I was having, like even still, like being flat but not having a binder on, just because my brain's so used to having a binder on all the time. And so it was a little bit tough to kind of get over that. And sometimes I still am out in public and I'm like, oh shit, I don't have a binder on, and then I realize, oh wait, I don't need a binder anymore. So it's still like a learning process, and I am just feeling real happy about it. I'm glad that my infection didn't really affect the aesthetic results as much because it was all in my drain, which there's like a hard ball right here that is supposed to like go away on its own. I don't have any fluid buildup. It's just like really tight and sore, and like my neck and my shoulders hurt, so I'm supposed to go see a physical therapist. Sorry, made me want to stretch, but overall I feel great. I think it looks great. I'm excited to be able to like maybe go back to the gym soon, and just start working slow. But my even just like lifting stuff, minimal stuff, few times, like I can feel get real sore in my muscles. So I don't know if I'm gonna be able to be where I want to be, but I think physical therapy will help, and just kind of like doing real light weights and just kind of building up from there. I skipped my testosterone update like I was doing every 2 weeks. This is the third week. But I mean, there's not really a whole lot of changes as far as that. I did notice, which I don't know if you can tell, but there's like hair that's getting dark right here that I just noticed recently. And then, like you already know, I have the little patches right here. My sideburns, I'm I have a lot of hair right here. It's just not dark yet. So I'm definitely getting chest on my hair, or hair on my chest, and on my stomach more. Like, I feel like this area is looking pretty masculine, and I'm really liking that. Feeling like I got some square shoulders a little bit. If I was slumping, this is slumping. So, still looks pretty square. But yeah, I want to get to the gym and freaking try and build up some of these chest muscles, build up my arms a little more, and get going. And as far as T, just mostly body hair. And one thing I did want to mention, though, was like how you go to the bar and like 85% of bars don't have a stall door in the men's room. And so it's like, if I go to a bar, then I can't go pee. Because I'm not going to go into the men's room and sit on the toilet when someone could just walk in. And I'm not confident enough with the STP to do it. And I'm definitely not going to go into the women's bathroom. So it's basically like I get to pee outside with the animals, which is kind of fucked up, to be honest, but I mean, I don't know. But also, something else that I really wanted to bring to attention, because I tried looking it up online, and there's really not a lot of information, hardly at all. Like, trans guys, when they get bottom growth and their stuff starts growing, like, at some point, some of them can penetrate with that. Or trans guys that have, like, a meta surgery where it's not going to be as large as the average size penis, but it's still large enough to penetrate. And so, where is there safe sex supplies for trans guys pre and post surgery? Like, if your penis is not large enough for a regular size condom, but there's no other condom that will fit, like, people were suggesting like finger cots, but I mean, like, that's gonna be too small. It's not as thin as like a condom would be, so it would take away even more feeling. Somebody suggested like dental dams, which, I mean, that's just not gonna work. Like, I don't know, but where is this? You know, somebody needs to bring this up, and we need to figure this out, because like the repercussions are a pretty big deal. You know. So I emailed my doctor about it, asking like who I could talk to, and I'm waiting for a response back. But I still think like, so like post surgery, do you have a higher risk or a lower risk or the same risk of being transferred an STI or an STD? Like, there's not any information about this out there, and I think it's important information to know, so I'm going to attempt to try and find some of that information out and see what I can find. But with that, I think, I don't know. So here we are, trans men and safe sex and bottom growth and chest removal. This is my reality, and people don't really understand that, but maybe it needs to be talked about more. So with that, I will peace out, and I'm about 2 weeks away from 9 months on testosterone, 2 days from 2 months post-op surgery. I haven't decided if I'm going to do scar care yet. The silicone strips that they suggest are really pretty expensive. I have super long ass scar, so I'm not really sure that that's going to be an option for me. I also don't necessarily hate my scar. I know that way my body is, that I'm going to have the scar forever, and it will probably always be visible no matter what I do. Although, I guess I can't 100% say that, because I've never used scar care on anything else. But when I scar, I scar. Like, it doesn't go away. So, I don't know. That's something still to be thought about. When I asked my surgeon about going out in the sun, she was like, honey, you shouldn't be out in the sun with your skin tone anyway. So I was like, but, like, that's one of the things. I want to be able to go swimming, maybe without a shirt on, maybe with just the tank top on. So, at one point, I definitely do want to go swimming without a shirt on. It's hard to be comfortable with my body, but again, my reality, my body, it needs to be talked about. So, I don't know, my friends. I will catch you another time. Miles signing off here.